Hello friends. Today we are going to discuss about coping with emotions and important life skills. I have discussed about various life skills and those videos are available on my YouTube channel. Please do subscribe and watch those life skills. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only, not for clinical opinion. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I am going to discuss about how to define emotions, need to learn for how to cope with emotions, strategies to cope with emotions, and how to teach children to cope with emotion. This video is targeted to school and college administration, teachers, policymakers, parents, children, NGOs, corporate, and community at large. Life skills. The core set of life skills have been advocated by World Health Organization. They have three domains. One is thinking, also called as cognitive domain, emotional domain, and social domain. Cognitive domain have four important skills: creative thinking, critical thinking, problem solving, and decision making. With regard to emotions, coping with emotions, empathy, coping with stress, and self-awareness. Coming to the social, it is important is effective communication and interpersonal relationships. Although these three domains have been clearly mentioned as a categorical, but all these 10 life skills are interlinked and overlap each other. In this video, I'm going to discuss about coping with emotions. Before we move further, we would like to discuss and define emotions. Emotions acts as a trait to help in the purpose of communication, thus aids in the survival of species. The Charles Darwin has clearly defined this. That means emotions is an important factor in survival of species. The best example I can give you is an animal in a forest, as soon as it sees a predator, it becomes anxious. It will flight. That means either it will fight or flight. It will run away from that place. That emotion of fear is very important for the survival of species. Hence, Charles Darwin told that emotion plays an important crucial role. Further, emotions are a brief, acute changes in consciousness, experience, and physiology that occur in response to personally meaningful situation. This is a second way of defining emotions. Further, emotions are feelings that generally have both physiological and cognitive elements and that influences the behavior. So, here there is an important component has been brought in. That is, feelings which generally has both physiological component, cognitive element which influences the behavior. So, emotion has been considered playing a crucial role in various other aspects. Further, it also has been defined emotions are determined jointly by a non-specific kind of physiological arousals and its interpretation based on the environmental cues. Here, the research scientist discussed about the physiological arousal and its interpretation based on the environmental cues. Again, environmental cues is basically the animal wants to survive in the environment. Again, it also goes back to the definition of Charles Darwin. Further, the emotions we feel results from the appraisal or evaluation of the information coming from the environment, the body, and the memory. As we got evolved, the man is in a civilized society. In this society, the predators may not be there, like the earlier we stayed in the jungle. Here, hence the definition also changed depending upon the environment. Here they have clearly defined, Lazarus has defined, the emotions we feel results from the appraisal or evaluation of the information coming from the environment, body, and the memory. That means basically interpretation of the information perceived by the brain. That's what the Lazarus said, that it is more than anything else how the animal perceives an event. Hence, as you see, it is very difficult to define emotions. Many researchers have tried to define emotions, but there is no single consensus about the definition of emotions. However, if you look at the definitions of emotions, there are some common variables which have been highlighted. Those are these variables. Emotions means the way we feel when we are emotional. That means it is an experience when we are emotional. That is the first one, important component. Further, the physiological or bodily basis of emotional feelings. That means what we feel. At the same time, there is a physiological arousal which is common in emotions. That means if you are anxious, the heartbeat occurs. If you are fearful, there will be tremors. You are holding fist tight to fight, or else to flight from this place. That means to run away from that place. So that is a second important component. Third, the effect of emotions on perception, thinking, and behavior. That means the emotions are influenced what we perceive, what we think, and what we behavior. That is the third important component. Fourth one is point out the driving or motivational properties of certain emotions such as fear and anger. That means emotions plays an important role with regard to survival of a species. For example, if the emotions are very pleasurable, the animal would like to have it more often. It may be sex, it may be food. If there is no motivation for sex or the food, the animal may not have it and it will perish. Hence, again, emotion plays a very important role in the survival. The fifth component is refers to the way in which emotions are expressed in language, facial expression, and gestures. The emotions are not only what the animal perceives, but also the way the body language, facial expression, and language as a words and sentences also play a role. So these are various important components which have been ingredient in various definitions. But however, one need to define mood also. There is a difference between emotions and mood. Mood have been defined as a sustained emotions or feeling that colors a person's perception of being in this world. That means it is emotion which sustains for a longer duration, which colors the life of a person is considered as a mood. Emotions are cross sectional, mood is longitudinal. That's what Sadok and Ruiz have defined it. Now, let's understand the types of emotions, because to know how to cope with an emotion, first you need to identify it. You need to feel how they react with your thoughts, behavior, and also physiological arousal. You need to know that. Hence, you need to define those emotions. There are some basic emotions. These also has been considered as primary emotions, or also the emotions which are there during birth. Anger, disgust, happiness, fear, sadness, surprise. Here, these are all common in all human beings across the culture, across the country, and across the globe. That means these are the basic emotions seen across all human beings, irrespective of culture. But however, as the person grows, there are something which comes self-conscious emotions. This means it requires a sense of self as well as an ability to order to reflect one's own action. That means the person need to have his self-esteem, need to have about the self as a perception, and is able to reflect on one's own action. Here, embarrassment, guilt, pride, shame, and also humiliation. So these are also self-conscious emotions which occur over a period of time. Sometimes they are also called as secondary emotion. Let me make my point very clear. These emotions are not categorical or pure in nature. There will be combination of emotions. There may be a combination of guilt and sadness, shame and anger, and also anxiety. Hence, the mixture of emotions are common rather than having a individual pure emotions. So, as we understood about the emotions, let's understand what are the components of emotions which we need to understand. Components means these are the variables which play an important role in the formation of emotions, maintaining emotions, increasing or decreasing emotions. First and the foremost component is thought. Thought and emotions are interrelated. If you have a positive thoughts, you will have positive emotion. If you have a negative thoughts, of course, you will have a negative emotions such as sadness, anger. Second one is behavior. The way your behavior, the emotions are also directly contingent upon that. Perception from five senses: what we see, what we hear, what we taste, and also touch, and also smell. If you are able to have a good perception from these senses, emotions are also directly dependent upon that. Imagine if you go outside in a beautiful nature, of course, you feel calming effect. That is, perception what you see from your eyes and also the smell of the nature will calm you down. That is what is perception from five senses. Next, as Lazarus has said that interpretation of an event plays an important role rather than the event itself. That is also important for emotions. Further, physiological arousal, along with that bodily sensation. Invariably, almost all emotions has contingent physiological arousals. For that, they also have bodily sensation. And important another component is memory. Memory of an event which leads to that emotion. For example, if I have sweets, I will get pleasure. I will have a sense of accomplishment. That means there is a memory of having a sweet which gives me a pleasure and also an emotion of accomplishment or something. In that way, the memory wants to pull you back to go and have those sweets. Or else it may be even sex or a love. Hence, memory also plays an important role. Further, the facial expression. So, although it may not be directly related, but however, it plays an important role as a physical component. As I mentioned, thoughts, emotions, and behavior are interrelated. Please see here. Emotions are usually modified by thoughts. Further, they are interrelated with physical symptoms and also behavior. That means all of them are interrelated. The best example I can give you is if a person has depression, that means disorder of emotion. In such a scenario, there is cognitive behavioral therapy. Here, you will be identifying those thoughts, or else cognitive errors, or else cognitive schemas, and also cognitive distortions and automatic negative thoughts. You will identify them, rectify them, which indirectly improves the emotion. That means depression will be overcome. That is what is thought. But again, there is a behavior. Cognitive behavioral therapy, we are talking about behavior. Behavior also plays an important role. If the behavior is positive, obviously emotions will be positive. So again, these are interrelated and these interrelated plays an important role in emotion. Further, environment also plays a role. What kind of environment you are in also plays a role in emotions. Further, what is the function of emotion? Why should we have it? First and the foremost is emotional health is an important part of overall health. Health is not just a physical health. Physical, mental health, and social health. That means social well being is very essential, not mere an absence of an illness. That's what the World Health Organization has clearly said. Hence, emotional health is an important component of overall health. And also, emotion makes our lives exciting, unique, and vibrant. That means if you do not have emotions, you are like a robot or a computer. That means you have an ability to think, but you will not be able to feel. That means if a robot is there, do you think the coloring of the life of the robot is it good? I don't know, it's a bland. Hence, the emotions are very important. Emotions color our life. The quality of life is dependent upon emotion. At the same time, intense emotions also play a role. Very intense emotion aren't all bad if you know how to control them, how to decrease them, how to regulate them. But if you are unable to regulate them, it may come in your way of thinking process. Emotions are part of our life. You cannot overcome them. You cannot say that I will not have emotions at all. Emotions are there and it is part and parcel of our life. Hence, we are human beings. Otherwise, if there is no emotion, that means it is a robot or a computer. So, emotions define human beings. Emotions prepares an individual for an action. Imagine, if you feel happy with your friends, you would like to meet them very often. If you are with the family members and you feel happy with them, you would like to meet the family members. If you would like to have a pleasure by having sex and reproduction, that will maintain the species. That means emotions play an important role, which plays an important role, especially with regard to survival of the species and maintenance of this behavior. For example, if you go on a certain place and you feel very anxious, you will avoid those places. That means again survival comes into picture. And also emotions plays very important in effective interaction with others. If you are happy with certain people, you would like to often interact with them. That means social emotions also play an important role. So, emotions have a very important function not only in survival of the animal, but also maintenance of social life, at the same time maintaining certain behavior, social skills, and the survival of species, which I have told. Now, let's understand coping with emotions. What do you mean by coping with emotions? Coping with emotions involves recognizing emotions in ourselves and others. That means you need to identify emotions in yourself and also identify emotions in others. Being aware how emotions influences behavior and being able to respond to the emotions appropriately. There are three important components. That means identifying emotions in self and others, being aware how emotions influences behavior, further able to respond to the emotions appropriately. That means emotions within us and also others. However, intense emotions like anger, sorrow can negatively affect on our thinking, behavior, health if we do not react or proactively act. That means if we react appropriately or inappropriately, it may have effect on his life. Now the question is why we need to cope with the emotions. Emotions are integral part of our life. They also color our life. The quality of life depends upon emotion. Why should we cope with them? There are certain times overwhelming emotions do play an important role. Overwhelming emotions means which are difficult to handle. That means the person who becomes very angry and he may not be able to think at that moment. In a fit of anger, he may commit a crime or he may hit certain person. That person may die. Or else, a person who is very anxious would not like to go out of the house at all. That means overwhelming emotions may come in the way of life. First and the foremost, if there is a high emotions, that person is unable to think, unable to concentrate, and also have difficulty in decision making and memory problems. Not only that, if a person is very irritable very often, it will come in the way of conflict. That means relationship may not sustain for a longer time. Imagine one of your friend is irritable most of the time and you may not like to be with him. That means there will be a problem in the relationship. Further, if the emotions has a kind of bumpy ride or else roller coaster ride, that person may not be able to concentrate, has a memory problems. Of course, there will be academic decline, trouble at workplace, trouble at school, and also to manage these emotions. Imagine if a person is very anxious, he wants to manage his emotions. That means he want to bring those anger emotion or else anxiety emotions or else feeling sad. You want to control those emotions. Invariably, many of these children and adolescents will start using drugs. Maybe cannabis, maybe alcohol, maybe morphine, opioid drugs, cocaine. These are the drugs which are used to self medicate to overcome those emotional problems. Further, because of this emotional problem, sometimes you can see physical outburst or emotional outburst. The best example I can tell you is road rage. When you are driving a car or a bike, suddenly somebody comes and cuts in front of you, you will become angry, you will shout at him. It may end up in fighting, physical fight, maybe ending in a murder, which is very commonly seen in metropolitan cities. Further, if a person is highly depressed or sad, suicidal ideas, suicidal attempt, death by suicide, deliberate self harm are common. Further, children who are intelligent not being successful in life because of poor emotional intelligence. Very often it has been seen the children who score very good in academics, maybe 95%, 100%, but they may not succeed in life. The main reason being is, although their intelligence is very sharp, but emotional intelligence is very poor. That means they do well in academics, but they may not be able to navigate the social life. Here, this IQ versus EQ plays a very important role. IQ means intelligent quotient, that is, intelligence, cognitive ability, whereas emotional quotient means how you understand your emotion, how you understand others' emotion, how do you regulate your own emotions, how do you regulate others' emotions. And also, these are very important to be in the society, to be happy in life, to be have a good relationship with the family members, relatives, and friends, and also with the colleagues. Hence, emotional quotient has a higher weightage, especially in the society, than the IQ. Further, if a person does not have good EQ, drug abuse, substance use to manage those emotions are very common. Further, internet addiction, gaming addiction to overcome the emotional problems are very, very commonly seen in children. Let's understand what will happen if there is a overwhelming emotions. That means if you see this picture, this is a brain and it is the medial part of the brain. That means middle section of the brain here. So here you can see the blue color is prefrontal cortex. This is the area of the brain which is developed very recently. The older part of the brain is amygdala, hippocampus, and the midbrain. These are the very important aspects of maintaining life. That means they are important in survival of species. Here, basically, it is importance for heart rate, heart center is there, breathing center is there. Those are the things which are there in the midbrain. Amygdala is the center for emotions, or may be called as anxiety. Of course, hippocampus is basically the center for memory. Here, if there is a overwhelming emotion, that means amygdala is acting, hyperactively it is working. In such a scenario, amygdala, the emotions becomes very high. The prefrontal cortex, which is a thinking center of the brain, does not work. That means amygdala will hijack the prefrontal cortex. The best example I can give you is, imagine if a person is highly depressed because of various reasons, because he has lost his father because of cancer. At the same time, he has lost his job, is feeling highly depressed, and he wants to kill himself. At the same time, he knows he should not kill himself because he has a wife, he has two children whom he is supposed to take care. And it is also wrong according to the religion. But unfortunately, when the amygdala is hyperactive, that it is telling you are feeling sad, what is the point in living? If the amygdala is in such a hyperactive state, sadness as overwhelming, at the same time, the prefrontal cortex shut downs and amygdala will take over. That means that person will act as per the amygdala and suicidal attempt or death by suicide is very common. This is one example. The second example I can give you is if you are driving a car and suddenly there is a city bus or a bus comes in front of you and it is about to meet with an accident. In such a scenario, you will be frozen and you have applied the brake. You do not know, your breathing increases and you are unable to think what to do next. You'll be frozen for a minute and you don't know what is happening around you. That is the time again. Amygdala is overactive or hyperactive. It has frozen you completely. You are unable to think properly. That is prefrontal cortex. The second example. Third example. If you are fighting with your friend, there is an argument going on. He will abuse you and you abuse him. And at a fit of anger, you start physical fight and all of a sudden you get a knife or maybe iron rod. And with that fit of an anger, you hit him on his head. The person dies. And later you will start thinking, what a mistake I have done in life. That means the prefrontal cortex will work only after amygdala hyperactivity decreases. That means once the emotion comes down, then only the prefrontal cortex starts working. Till then, You will be on the height of the emotions. That means whenever you have huge emotions, overwhelming emotions, do not take decisions. Invariably, the decisions will be wrong. Hence, you need to learn how to regulate your emotions. That is coping with emotions. Now, need to be trained in emotional intelligence is very important. That means, till now I discussed about the emotions, I discussed about coping with emotions, but however, this video is incomplete without discussing about emotional intelligence. As per the psychologist Daniel Goleman, he clearly said that there are four important factors of emotional intelligence. One is knowing your own emotions, also called as self awareness. Managing your own emotions, that is self management, and also motivation of yourself. This is about self. Further, if you need to recognize the emotions in other, that is social awareness, and relationship management, that is managing relationship with others. So if you look at the two quadrants are there, one is the self and other. This is self, that is knowing your own emotions, managing your own emotions, and motivating yourself for the future, that is to work. But however, the others is basically understanding the emotions in other and also managing their emotions. So that is the social cognition, or also called as social awareness, and also social emotions we can be considered. Let's understand emotional intelligence and quotient. Here, if you look at this as a pyramid, the base of the pyramid is self awareness of the emotions. That means you need to first identify your emotions, understand about your emotions, how the emotions are managed by your thoughts, behaviors, physiological arousal, symptoms, how you perceive, how you interpret the event. That means the base of coping of an emotion is self awareness. Unless you are aware about your own emotions, how will you understand others' emotion? If you don't know how to manage your emotions, how will you manage others' emotion? So, the basic or the base of the pyramid is self awareness. The next part is controlling of one's own emotion. If you are able to regulate, that means how to increase your emotions, how to decrease your emotion, how to maintain your emotions. That means controlling your emotions at your will is the second. The third one is identifying and managing others' emotion. So these are the three important components which are need to be discussed in emotional intelligence and quotient. Let's understand how emotions are dealt with regard to event. If there is an event, it may be your boss yelled at you, or else your father is shouting at you. The emotions are you are sad, maybe angry also at the same time. It may be the interpretation of the event. That means my father is shouting or my boss is shouting at me. That means I'm useless. If I'm useless means I'm worthless. I'm good for nothing. Invariably, you'll become sad. Or else you're angry with your boss. How can he shout at me? Over a period of time, you realize you can't do anything against your boss or your father. You'll become sad. So, how do you interpret an event? How do you perceive an event? Plays an important role. If the same event, my boss is shouting at me, I'm happy, I'm irritating him. If you feel happy, that means you are able to disturb your boss and you're interpreting that I'm winning. You may not be angry at all. You may be happy. You may be euphoric. That means you are able to control your boss' emotion. That means it is the interpretation of the event rather the event per se itself. That's what the Lazarus has said. So, to summarize, my dear friends, emotions are controlled, or the components are thoughts, memory, past events, your own behavior, physiological sensation, symptoms, and the environment where you are all play a role in emotions. Now let's discuss about learning the skills to cope with emotions. That means how to deal with your own emotions, how to regulate your own emotions, how to identify others' emotion and control or deal with their emotions. First and the foremost, before you learn this skill, you need to understand one important thing. There are two important components: implicit skill and explicit skill. Here, I'm discussing about the learning model of the skills. It is considered as conscious competence model. This was given by Martin Broadwell in 1969. Here, if a person starts with unconscious incompetence, he does not know that he is incompetent at all. The next one is conscious competence. He knows that he is incompetent. Next, consciously he is trying to be competent. The fourth one is unconscious competence. That means without even thinking he is competent. Let me give an example to this. When you are in the age of 15 or 16, you do not even think about driving a car. That means you're not thought about it. You're not aware that you are incompetent of driving a car. That means there is denial, or you are not thought about. That means unconscious incompetence. You're not thought about it and you're not competent. But now your father has brought the car. You want to learn. That means you're conscious now, but you know that you're incompetent. You can't drive. Earlier it was implicit, now it is explicit. That means I want to learn, but I'm incompetent. The third yellow part, it says conscious competence. You now will go to your driving school and you want to learn driving, and you are focusing. When you try to drive first time, second time, remember you had panic attacks. You are focusing on the pedal, you are focusing on the accelerator, you are focusing on the brake, you are focusing on the maybe looking at the steering wheel. At the same time, you are looking at the road also. You have a panic attack if somebody comes in front of your car. Here, it is called as conscious competence. You are able to use the skill but with efforts, effort of consciousness. Once you start practicing the driving skill over a period of time, maybe around 6 months or 1 year down the line, you don't even think of driving a car. Unconsciously, you will be driving the car. You'll be thinking something else. That is called as unconscious competence. Look at this. This is a very important model. You're not aware about the incompetence, and you're unconsciously incompetent. That's basically you're not aware at all. Next one is you're aware that you're incompetent. That is the second. Third one is consciously competence. And finally, unconscious competence. This is the best example I can give you with regard to the car driving. Now, with regard to emotional coping is the same thing here. If you do not know what are those emotions, what emotions you need to regulate, how to control them in yourself, that means you are in an unconscious incompetence place. That means you do not know there is emotions in you and you need to control them, otherwise it is impacting you in the long term effect. That means you are in complete denial. You do not know anything about it. Next, now you will start identifying, yes, there are emotions in me. And you are unable to control your emotions, especially anger. That means you are conscious, but you know you are incompetent. Now, you will listen to this video. You will start going and meeting therapist. You are now making efforts to control your emotions. You are giving all your thoughts, process, attention, concentration to control those emotions. That is called as conscious competence. And once, if you practice for 2 to 3 years or 5 years, it becomes unconscious competence. That means you know how to regulate your emotions without even thinking. That is what is the important aspect of practicing in emotion. Just because you have watched this video, you will master your emotion control. No, it is not possible. You need to practice. The practice makes man perfect, but you need to practice the right thing. Otherwise, if you practice wrong things, you will do wrong things repeatedly. Here, you need to practice right thing to have right one. So the first step is denial. You do not know anything. Unconscious incompetence. Now you know that you need to learn, but you are incompetent. Conscious competence. Now you start learning. That is conscious competence. Finally, if you are practicing many times, it becomes part of your life. That is unconscious competence. That is mastery. And finally, super competence means once you have learned, you are teaching your kids. That is super competence. That means you may be teaching your kids, your friends, your relatives, maybe anybody. So, learning to ride a bike is another example which I can give you from unconscious competence to conscious competence and then moving to unconscious competence. That is, and again, if you teach bike riding to other people, it becomes super competence. You need to understand this. So, practice makes man perfect, and you need to practice the right exercise, not the wrong exercise. If you practice wrong things, you will learn wrong things, and the outcome will be wrong. Now, the question is how to teach coping with emotions to people, especially children and adolescents. If you have a problem, that means you need to change it. What are the things you have? Yes, for a problem, there is a solution. That means you need to focus on solving the problem. That is called as problem focused coping. Yes, there is a problem, you need to change it. But there is no answer. That means you need to focus emotion based coping skill. If there is no time to act, that means you have a problem, but the answer is after 5 years, or maybe 6 years down the line, or maybe 1 year down the line. Again, you need to have emotion focused coping. This is the best chart I can tell you, but the best example I can give you is there is a problem. The problem is your father has died, or a person whom you love has died. Do you have any solution for it? No. The person has died. Now you need to learn how to deal with your emotions. Of course, you cannot bring that person. There is no solution for it. But here, emotion focused coping is very essential. Another example, if your father has cancer, you need to find the answer for it. One is try to go and meet the doctors, find a solution. If the treatment is available, focus on the treatment and treat the cancer. That is problem focused coping. Now you have done the treatment, but you realize the treatment was failure and the time is very short. Now you need to move from problem focused coping to emotion focused coping. That means you'll focus on how to deal with your emotions. Hence, you need to know both how to deal problem focused and emotion focused. In this video, we are focusing on emotion focused coping. So, here again, emotion based coping has two things: intrapersonal coping, interpersonal coping. That means you need to learn how to deal emotion in yourself. That is intrapersonal, emotions between two people. That is between me and you. That is interpersonal, or else between the society members, other citizens, relatives, friends. That is interpersonal. That means both are very essential. First, now we will take intrapersonal coping. That means you need to identify your own emotions, deal your emotions, cope your emotions. If you are able to mastery in yourself, it is able to understand others' emotions and deal others' emotions. That is interpersonal. Let's talk about intrapersonal emotional coping. First is identifying emotions. That means you need to learn how to identify emotions and also teach kids, adolescents, how to identify emotions. How to do that? If the child, maybe at the age of 2 years, 3 years, 4 years, you can teach identifying emotions. Nowadays, you can find emoticons, especially in iPad, maybe in mobile phones, computers, laptops. You can show emoticons and ask them to identify. Maybe in the computer, and also so nowadays the balls are available, sim soft balls or stress balls are available. It also has emoticons. You can ask the child to identify those emoticons and ask them to name them. Or else photographs of people who are sad, who are happy, who are anger, who are frustrations are showing. Those photographs can be shown to the child and ask them to identify the emotions based upon their facial expression. Once the children are able to learn both of them, you can move to the animations. Basically, the children love to watch maybe cartoons. Whenever the cartoon expresses emotion, pause the video, ask the child, what is that? The animation may be a Spider-Man, or else maybe the Spider-Man is a wrong example because it doesn't have facial expression. Suppose if it may be Tom and Jerry. Here, the Tom's facial expression is there. It may be anger, it may be anxiety. Those, how the child is identifying it. And depending upon the identification, you can give reinforcement to the child. Further, not only that, you can now move from the animations to the TV, especially serials, identifying the emotions in a serial or a movie. Pause the movie and ask, what is the emotion which the person is feeling, the hero is feeling? What is the emotions between the father and son in the movie? So, those kind of naming the emotions in an objective way is very essential. Maybe films, and the best is advertisements. What is the emotions which arises from watching this emotion inside you, or else what is the emotion which is there in the TV commercial? So those kind of things you can start teaching to identify. Later you start talking about real people. If the people are fighting, you can ask what is the emotion in Mr. X, Mr. Y. So identifying emotion in others. Now, once they are able to name the emotions, identify the emotions in other, now you start labeling the emotions. That means when it happens in them, how do they label them? Now, kids need to be taught to identify and name their emotions, what they feel. Here, you need to say, whenever the parent, if they see the child who is very sad, crying, now parents need to name those emotions whenever they experience it. That means if you see a child crying, you say, oh, you are feeling sad, you are crying. Now you need to identify and teach the child, yes, this is what is sadness means. If the child is scared of going out or else scared of stranger, you can say, see, this is called as anxiety or fear. So you can name those emotion so the child identifies it, what it is experience has a name, and it is also normal. Now, over a period of time, it will start expressing those emotions. Sometimes you need to tell the child, if the child is irritating you, you can say, I'm feeling angry. So, or else at the same time, if the child is angry, okay, you are angry. That means you are labeling. At the same time, the child is able to understand and comprehend the emotions what it is going through. If the child has lost the toy and the child is feeling sad, you can say, oh, you're sad because you lost the toy. So, in such a way, you are also naming the emotion and also making the child to feel it is very important. That means, first one is identifying, labeling. At the same time, you're also telling them what is their experience and how the name and the experience goes together. Once, if you are able to do that, the fourth step is ventilation. Imagine the child is having a severe anxiety or else sadness. In such a scenario, the child should know how to express those emotions and ventilate those emotions in a healthy way. What do you mean by ventilation? Ventilation is a process in which the client is allowed to talk and share his or her thoughts, feelings, and emotions freely. Here, the child should know how to deal with the overwhelming emotions. How to do that? Building rapport if it is a third person, and if it is your own child, rapport is not required. Now, once you know the child has feeling sad, now you should ask the information. What happened? Can you explain me about this? Understanding the situation. And then allowing the child to express his emotion. Don't stop the emotion. If the child is crying, don't tell, don't cry. No, let the child cry. At the same time, you should start working, once the emotions comes down, start working on their cognition. Try to recheck their thoughts and try to relabel those thoughts or restructure those thoughts. That is very essential. If you understand this, ventilation is very important because that is where the child understands how to cope with emotion. Venting is a great way to release suppressed emotion, feelings, and thoughts. That means by ventilation, if the amygdala is hyperactive, by ventilation, you are calming down the amygdala and then prefrontal cortex starts working. That is what we want. And ventilation has to be done with only with the close people, maybe friends and relatives, or else maybe family members. You should not ventilate with everyone. That will be more harming to yourself. At the same time, ventilation of sadness is very essential. And also you should know if a person is ventilating and if he has obsessive rumination, or else he repeatedly gets those thoughts. In such a scenario, he will continuously ventilating and the other person who is listening will become irritated. Hence, ventilation has an important role to play, but at the same time, you need to know the person has an emotion which needs to be ventilated. But if it is like an obsessive compulsive disorder, he may continuously ventilate by asking for compulsion. Compulsion means he will repeatedly ask the same thing 100 times. Hence, ventilation should be used cautiously. Fifth one is managing emotions. Ventilation is one way, the other way of managing emotions. Meditation, prayer, listening to music, dance, distraction like exercise, swimming, movie, jokes, walking in the nature, taking a trip, taking a break, all those plays a very important role, but it is a short term. Long term, it's not going to help. In short term, again, it is helpful if the person do not have rumination. If a person is continuously thinking about the same event or the same thought, how can he shout at me? Is the thing. That means father and son has fought. The son has shouted back to his father. Father is continuously thinking, how can my son shout at me? And he's trying to calm, he's trying to distract himself. But still, he is getting this thought repeatedly. In that time, the distraction is not going to work. It is going to accentuate. That means you need to know under what circumstances this can be used. Sixth one, mindfulness. Here, in the mindfulness, there are important formula which need to be learnt. One is mindfulness is living in the present moment, not in the future, not in the past. You need to live in the present moment. And here, if you are moving either into the future, you will become anxious. If you are going into the past, you will become depressed. In such a scenario, you need to intentionally bring the awareness to the present moment. Present means it is a gift of the present. Don't go to the future or to the past. That means you are not living in the present moment. And being fully engaged, what is happening in one's surroundings is very essential. That is mindfulness. Further, whatever emotions you feel in the present, you should accept that non judgmental. That means you are not going to decide, yes, this feeling sad is wrong, being angry is wrong. No, you will have a non judgmental acceptance. And you'll be a spectator for those emotions. Yes, I have this emotion of anger. Fine, it is anger. That's it. Let go it. You identify, label it, and let go. That means you're not stopping it. And also, that means you're not suppressing it. At the same time, you're not get carried away. You'll be just a spectator. You will observe the emotions to move in front of you and you will not get carried. At the same time, moment to moment awareness of one experience without judgment. Here, the non judgmental is very essential. All emotions, anger, love, fear, anxiety, colors the life. It is a rainbow color. That means all emotions are required. There is no one emotion which is wrong, which is right. No. All emotions are there in life. Accept them, feel them, leave them. That is what is very essential. No emotions are constant. For a moment, I'm happy. Next moment, I may be sad, depending upon the event. And the third moment, I may be angry. That means nothing is permanent. What is permanent? Permanent is change. Change is permanent, not the constant. So you need to accept that. The emotions which you feel today will pass tomorrow. Day after tomorrow, the new emotions will come. So change is constant. Seventh one is behavioral engagement. What does it mean? Here, you will control the emotions through behavioral management. One of the best example is in depression, we do behavioral activation method, such as activities of daily living, asking him to get up at 7 o'clock, do brushing, taking bath, going for a walk, and also asking him to a library, watch certain activities, do certain yoga. So activity scheduling. At the same time, behavioral contract. If you are able to do this reading of the book for half an hour, you will be going outside, meeting people. Body posture. If you have a good body posture, at the same time, your emotions will be in the positive direction. If you're able to do this, there will be reward and reinforcement. That means the behavioral activation will also improve your emotions. That's what it means. And it has been proved beyond doubt in depression. Moving to the eighth point. This is ABC analysis of emotions. For a long term understanding, learning the skills, ABC has to be understood. Analysis of extreme situation is very essential. Whenever you are extremely angry or very depressed, immediately start thinking about that. What is the antecedent? What was my behavior and what is the consequences of it? Whenever there is a overwhelming and extreme emotions, do not react. If you react, the behavior will be wrong. You may be angry, you may hit someone. Take a step back and objectively analyze. Yes, I'm feeling these emotions. Why I got this emotion? What are the thoughts? What was my behavior? Or what will be my behavior? And if I do that, what is the consequences? Or else, just half an hour back, you became angry towards your child and you hit your child. Now the child is in pain. At that time, you have to do ABC analysis. What was the antecedent? What was my behavior? What is the consequences? Is it the right way to deal your emotions? So that needs to be questioned. And analysis of each event is very essential whenever there is an extreme emotions. Ninth one. This is the where a very important way of coping with emotion is learned. That is 5-column chart and journaling. Here, the first column is time. Morning 7 o'clock. Next, what is the event? That event, what is the thoughts? What are the sensation, behavior, and rate the feelings. By doing this, you'll be able to understand how the thoughts, emotions, behavior, sensation, event are interrelated. Let me give an example. Early morning, 7 o'clock, you got up, saw the newspaper or in the laptop that you have failed in the exam. That is the event. What are the thoughts? Thought is, oh, I failed in the exam. What will people will think? What will my friends will think? What will be the relatives will think? What will my girlfriend will think? I'm a failure. And all of a sudden, you will have panic attacks. You will feel sad. You will have headache, tiredness. The behavior will be, I want to commit suicide. I'll run away from this place. Now, you have to rate the feeling, whether it is positive or negative. Of course, feeling sad will be negative. So you'll be putting as -10, -9. So if you are able to chart your emotions on daily basis, maybe 3 to 4 times a day, will give you a rough idea how your thoughts, emotions, behavior, and sensations are interlinked. Once you are able to understand that, it is able to now manage or regulate your emotions. Hence, journaling is very essential. If you are able to do this journaling over a period of time, you will be entering into unconscious competency area. So, first and the foremost, what are the things? Identify and label the emotion. ABC analysis, that is antecedent, behavior, and consequences. Not reacting to the emotions. Observing these emotions. Experience these emotions in a distant, non judgmental spectator, and you will proactively deal with these emotions. That is very essential, and it can be done by journaling the emotions in 5 columns. And another important is positive affirmations. Positive affirmations means these are personal affirmations or constructive statement about yourself, saying loud. Or else, the act of rectifying positive comments about self will enable to manipulate the moods in few individual. The best example you can see, especially the sportsmen, if they are playing, especially the people who are playing cricket, or else maybe a bowler. When he does it, you can see he will be talking to himself, he'll be saying, I can do it, I will do it. Or else the behavior, what he does, what he says to himself and he says to others, that is what is positive affirmation. The other example is if a player who is playing tennis, if he loses a set, he will start telling, I can do it, I will do it. So that positive affirmation also improves the emotion. Because since he has lost the set, he will feel sad. Instead of feeling sad, if he feels sad, he may not win the next set also. Hence, he need to rise above that. Then the positive affirmation sometimes works. Now, from the intrapersonal emotion, I will move to interpersonal emotional coping. That means here you'll be dealing the interpersonal emotions. Here, interpersonal emotions, there are two types: intrinsic and extrinsic. What do you mean by interpersonal? It is the process of changing the emotional experience of oneself or another through social interaction. That means you're trying to manipulate your emotions or regulate your emotions, that is the best word, through social interaction. It can be your own emotions or other person's emotion. That means when a person is sad, he's staying in a room. What does the family say? Why don't you go out? Why don't you meet your friends? Why don't you go and have new friends or just go outside and come? That means by social interaction, you are trying to change the mood. Here, there are two types again: intrinsic and extrinsic. Intrinsic interpersonal emotion regulation involves managing one's own emotions through social interaction. Extrinsic interpersonal emotion regulation refers to the deliberate influence of others' feeling. Imagine if your friend is depressed, you will talk to him. You will try to do pep talk. You will try to interpret on your own and you will try to cheer him up. That is extrinsic interpersonal emotion regulation. So, along with this, you need to understand empathy, that is understanding others' behavior and emotions. That is putting yourself in other person's shoes. I'll make a separate video on that. Please click the link above to go to empathy video. Further, communication is very essential and there will be a separate video on communication. Further, dealing with others' emotions. Now let's discuss about dealing with other emotions. Dealing with others' emotion, first and the foremost, is identify the person who is in distress. It may be your friend, it may be your family member. If you are able to identify they are in distress, now the rapport building, if you have a good rapport, it's excellent. Discuss about their distress. Ask them to talk about their distress. When they are discussing or telling about their problems, active listening is very essential. By doing active listening, you are facilitating the ventilation. Once you are able to ventilate the person, amygdala hyperactivity start decreasing. Now you empathize that any person in your place will have this emotion. That is validating the emotion and give time to heal. By doing this, you are able to regulate the emotions in other people. Now the question is that is about the adult. How to teach kids to cope with emotion? If the kids are in distress, they are crying or they are angry, they are jealous, they are showing temper tantrums. This is an opportunity to teach for the parents or maybe the guardians. So, whenever such distress signals are seen, jump in and try to deal with the child, because by dealing this child, you'll also teach them indirectly how to deal with such emotions. First and the foremost, listen to the child, empathize, facilitate the expression of emotions. That means if the child is crying, allow the child to cry. If the child is very anxious, you sit with the child and allow the child to feel those emotions. Now, label those emotions, what the child went through. Help the child to identify those emotions. And as I said, allow them to express those emotions. Now, validate their emotions. That means don't say feeling sad is wrong. No. Sadness will come in everybody's life. If the child is scared, tell feeling scared is part of life. Everyone gets scared. So, validate those emotions and you tell them these are all temporary emotions. After some time, it will go away. Emotions are like waves. It comes, sadness wave will come, it will go off. Anxiety wave will come, it will go off. That means none of the emotions are constant or permanent. Allow time. Teach them how to cope with this emotion, how to do problem solving. At the same time, if the emotions are too overwhelming, seek help. Help from the family members, relatives, friends. Sometimes you may require therapist help. And teach them adaptive coping skills. That means if the emotions are too high, ask them not to take drugs, ask them not to self medicate, such as alcohol, cannabis, cocaine, morphine. Ask them not to do that. That means you're teaching your child how to cope with emotions. To conclude, my dear friends, coping with emotion is a very important skill which need to be taught to children and adolescents. What are those steps? Teach your kids how to identify those emotions in themselves and others, labeling them. Yes, this emotion is like this. That's what I experienced. Being non judgmental. Any emotions will come to everybody, and it has come to me today, and it will pass. Accepting it and telling that these are all temporary. Prompting the child to identify, also to point out the strategies you are using to deal with the emotions. You should tell them, yes, I also feel anxious. I also feel sad. What are the ways I cope? Teach the child also how to cope with those emotions. And also allow those emotions to be expressed in a confiding relationship. That is very important because, in the long run, that is the best way to deal with the emotions when you are extremely overwhelmed with such emotions. Ventilating in front of your friends in a confiding relationship is very essential. At the same time, validating their emotions and cognitive restructuring helps. My dear friends, emotions are the one which determines human being, which determines the quality of life, which will color our life. So, emotion, coping with emotion is an important skill. Please teach your children and adolescents. Thank you very much for giving your valuable time. Stay safe.